So I'm just going to welcome everybody that's joined us so far. Um, we are very happy and excited to be with you today and to share with you some stories from our SEBA project. So from a little bit of introduction, obviously, as we all know, this is a session predominantly on knowledge translation. So bringing evidence into policy and practice discussions, we all know is very complex. So we have some of our research teams from Malawi, Ethiopia, Rwanda, and South Africa that have embedded an integrated knowledge translation approach to the research that they've been doing on non-communicable diseases, that they've been doing as part of a collaboration for evidence-based healthcare in Africa. It's a consortium with that acronym that we summarize to SEBA, SEBA Plus. It's a collaboration for evidence-based healthcare in Africa. And the SEBA consortium has been engaging with policymakers, with practitioners, with the media, and with communities to enhance the uptake of key results on hypertension, on diabetes, and also on road traffic accidents. So the purpose of today's session is to really focus on, to really help us focus on these experiences that our researchers have had when sharing new evidence, but also addressing the misrepresentation of evidence in an era where science and research are devalued and politicized more than ever. And as we all know, research is so important, and publishing the findings of our research is so important. But that none of that is useful if those findings don't get into the hands of the people that can actually action on that evidence, people that can change policies, that can change practices, that can influence the public to improve the way that we screen for non-communicable diseases, the way that we influence our practitioners, our patients, and in the case of road traffic accidents, also a multitude of stakeholders that are involved in how we improve our access to safe roads and practices, but also the way that we influence the public in using this safely. And so in this session, we use a storytelling approach to hear from our SEBA team. Our storytellers will share their experiences while touching on the political economy of evidence use and stakeholder engagement. Importantly, though, our speakers will also address the importance in how engaging with a variety of stakeholders have affected them personally and professionally, and hopefully open a window to discuss how we can support each other in one of the inherent challenges of our field. So we thank you all for joining us for a spirited storytelling session that will have us reflecting on integrated knowledge translation and stakeholder engagement. So welcome, everyone. I'm going to start first with introducing Bonnie Balugaba Enoch. He is a research associate under the Department of Disease Control and Environmental Health at Makerere University School of Public Health in Uganda. He is currently based in the Trauma, Injuries, and Disabilities Unit, where he has worked on a number of projects, including prevention of drowning, road safety projects, and child safety projects. Welcome, Enoch. Or Mr. Enoch. We're going to call you Bonnie from now on, Bonnie, because that's how we all know you. So Bonnie has worked on a very interesting project, and I'll ask you, Bonnie, to tell us more about it. But it focuses on the road infrastructure in Uganda and the fact that it doesn't take into account approximately 4.5 million Ugandans who are persons with a disability. And Bonnie is going to be describing with us how they have engaged with engineers, with the police, with the Ministry of Roads and Transport to find solutions to this problem. Welcome, Bonnie, and please share with us how you've been engaging on this very critical issue on access for the disabled, particularly in Uganda. Over to you.
Yes, thank you very much, Nazreen, for the introductions. I'm fine with Bonnie. I mostly use that. So as part of our SEBA work, one of the objectives was to carry out a road audit, road infrastructure that we have in Uganda. We were mostly focusing on pedestrian safety, and so we selected road sections that had been identified to be highly problematic. This was based on the numbers that were reported by the Uganda police as crashes, that areas that had a very high number of crashes from the reports. And so we hired engineers from College of Computing and consultants from within Uganda. And they carried out this work with input from us. We had to customize the list to ensure that they are mostly focusing on pedestrian needs, as opposed to the general road audits that are done with minimal focus on pedestrians who are vulnerable road users. What advised the selection of this group was 40% of the road traffic injuries in Uganda involve pedestrians. And so they were a very important group to work with for this. And so we then went out and looked at the roads, and we identified a number of road safety issues. But then of particular interest was, despite the fact that, yes, pedestrians are vulnerable, we discovered that actually there were no adequate protected facilities for all pedestrians. But then the situation was even worse of if a pedestrian had a disability. If someone uses a wheelchair, if someone uses is blind and so needs audio assisted crossing points, those we didn't have in Kampala. And all other sections of Uganda, we had the review conducted in 3 districts of Uganda. And so we came across all these, and after identifying these problems with the engineers, a report was written, and we had a stakeholder meeting where we had multiple stakeholders from the Ministry of Works and Transport who are in charge of the highways in Uganda. Then we had Kampala Capital City Authority, who primarily deal with the roads in Kampala that are not considered highways. And so then we had discussions with them, and we also had Ministry of Gender and some representation from the NGOs, non-government organizations that deal with the needs of persons with disabilities. And so we had discussions. We then had an issue brief that was largely facilitated by the Stellenbosch team. And so we met the Directorate of Engineering within KCCA. KCCA is Kampala Capital City Authority. And we had discussions, and so far there has been some signs of commitment from these people, and the work is moving forward. We are trying to see that the current provisions, KCCA, I think, has some funding from stakeholders, and they're trying to put into consideration the needs of all road users. We recently had a symposium where we actually had someone from one of the biggest umbrella organizations for persons with disabilities. That's NUDIP, National Association of Disability something. I don't remember the actual format in full. And so we had someone come and talk to these stakeholders, talking from experience, as opposed to Bonnie, who says, "Oh, I've read about the needs of these persons living with disabilities." And so here we had someone that was blind and was talking to these stakeholders from experience and like adding face to the theory that we had, and that was largely impactful. We had also some other sponsored organizations and funders come into the room, and so currently we have some engagements that are ongoing, and we are hopeful that one, we were able to identify the problem right from it being a problem to an individual. You see, road traffic injuries and crashes being highly prevalent in Uganda, as is the case with so many of other anyone could be injured. That's something that we wanted stakeholders to appreciate. And so, although one could be walking today, tomorrow they might be in need of facilities that have to cater for persons with disabilities. So currently, the discussions are in high gear, and we are hopeful that now moving forward, they will be able to clear the pedestrian walkways, because from the audit and also from moving around Kampala, you discover that although some areas have walkways, they're actually occupied by motorcyclists, they're occupied by street vendors, and sometimes they are actually vandalized. You find that if someone is in a wheelchair, they are forced to use the carriageway and compete with the motorized traffic because they can't access the pedestrian walkway that's since it's raised. I think I'll stop at that for now and hand over to the moderator. Thank you.
That's fascinating, Bonnie. Thank you so much for sharing that. Please tell us, how were you able, I mean, you brought a human face to it, which is really important, I think, when we're trying to use research results to influence change. It's often just numbers on a piece of paper, it's theory, it looks very abstract, but you were able to humanize this. You spoke to the heart, not just the head. What can you share a little bit about what kind of impact that's had on spurring action and in terms of your stakeholders and the importance of understanding this problem?
So I might not be able to quantify the kind of impact, but at least from, you see, when you have, let's say, a meeting and you have different presenters, and then there is a particular session that has everyone active, and then people starting to share in and also share their experiences. Sometimes we live with certain things, but we tend to ignore them because we feel we are not affected. But we had a lot of this, and then we had journalists actually come and talk to us. We've had journalists ask for the contact of the person that gave that talk. And so we are hopeful that, and also I think talking about journalists, we set out to use them as a tool to pass on information to our stakeholders. Because many times as researchers and scientists, we focus more on how many publications have I got, will I be able to get this promotion? But now the journalists sort of, if you get the message to them rightly, they sort of have a way of bringing shock to it, so that they make people realize this and start to act. So at least we have interest from journalists. They are asking for the contacts of these people, and perhaps when then they talk to this particular individual, he will point them out to another individual, because the person that came for the presentation was visually impaired, but perhaps he showed them another person that can't walk freely, or another person that has mental disabilities. So we feel that we sort of initiated a discussion regarding funding for the work. That's a largely political issue, although we had a leadership of Kampala Capital City Authority in. Hello? Yes, although we had leadership of Kampala Capital City Authority in and Ministry of Works and Transport, we know that for them to finally get a budget line to work on some things, there is a lot of work. But if journalists and other stakeholders keep bringing this to the forefront and running stories, featured stories on their bulletins and normal stories, then maybe our members of parliament and those that are in charge of decision making will actually pick this up and start off. We had a pilot that started, I think, 4 years ago on a non-motorized corridor in Kampala. Maybe we'll have more of those, because we also had someone from the National Planning Board who is very enthusiastic. Her main area of enthusiasm is cycling in Kampala. And so they are trying to see how best to provide for the needs of different road users, with particular emphasis on persons with disabilities, because so many times in the discussions, we actually forget them. We even hold meetings to discuss persons with disabilities in hotels that have no provisions for them, and so they actually end up not accessing them. So yeah,
That
we
is
feel
very interesting.
some interest has been developed.
Yeah.
Thank you.
That is so interesting, and the importance of using intermediaries like journalists and champions, I think is a really interesting take on how to make sure that research has a wider is accessed by a wider sense of the public, using others and collaborating with others that can help get the message across. Thanks so much, Bonnie. And I want to welcome Talitha Mpando, who's just joined us. You feel free to put your video on, Talitha, so we can see you. And sorry for the troubles joining earlier. I'm going to give Talitha a moment to just settle in and introduce you to Firaul. So Firaul is another colleague on this project. He's a senior mental health specialist with a master's degree in integrated clinical and community mental health, but also a degree in psychiatric nursing. So he comes with a very interesting perspective to this program on NCDs. And over the last 4 years, he has worked as a lecturer, a clinician, and a researcher at Mekelle University's College of Health Sciences, the Ada Comprehensive Specialized Hospital, and also our partners in this, the Armhar Hanson Research Institute in Addis Ababa. Welcome, Firaul. So cardiovascular disease risk perception in urban and rural communities in Ethiopia has been very low. And Firaul is going to share his experiences engaging with their communities to understand CVD risk perception, but also the implications for the Ministry of Health. Firaul, welcome. Tell us about the project in Ethiopia and particularly how you've integrated knowledge translation and engaged with your stakeholders.
Thank you, Nasreen. Thank you very much. So the story I'm going to tell you today is about our experience engaging with urban and rural communities to understand CVD risk perception during our citizen science research task under Sebaha Plus project here in Ethiopia. So to begin with, in Ethiopia, population-wide CVD preventive interventions are limited and notably absent in rural settings, while the prevalence of cardiovascular disease risk factors are rising. Even though non-communicable disease prevention activities are included under the health extension program's work package, limited attention has been given by the government and non-government organizations supporting the program. So researchers at Armor Hanson Research Institute under Sebaha Plus Consortium Research Project interviewed communities from both urban and rural settings in Ethiopia to understand community awareness of CVD and perception of risk factors. So before the implementation of the study, we have conducted stakeholders consultation meeting, which was very, very helpful. Then we have selected and trained local citizen scientists based on the consultation of our stakeholders. So on our study, we have found 3 key findings, and the first one was participants' awareness toward the CVD was found to be poor in both urban and rural settings of Ethiopia. And secondly, common cultural perceptions is that CVD is untreatable owing to inaccessibility of care, and the common belief that this is the will of God was the second key finding of our research. And finally, community perception of CVD risk is low despite beliefs that the risk factors are common. Then, after finding these key 3 findings, we conducted a community advocacy meeting to disseminate the result and to put a way forward. So on the meeting, we prioritized two main problems based on measuring magnitude, severity, feasibility, ability to bring measurable impact on the issue, and community's willingness to and the capacity to act on the issue. So the prioritized problems were awareness gap regarding CVD risk and limited number of skilled or trained healthcare providers on CVD. After discussing on the prioritized problems in detail, the following action points suggested by the stakeholders themselves. So they were like educating community using leaflets, posters, and the paper-based readings, using mass media to educate the community, using voluntary health workers to educate the community, awareness creation activities at religious places, awareness creation activity at school, promoting and encouraging physical exercise, awareness creation activity at private clinics, and organizing training for health providers on CVD. So all these way forwards were raised by the stakeholders themselves after discussion. So based on these recommendations, we have prepared an issue brief for Ethiopian Ministry of Health NCD division, mentioning the following three priority actions. The first one was building the capacity of health extension workers on NCD prevention strategy and educational interventions. And the second one was enforcing different stakeholders working on NCD to integrate educational intervention initiations in their program area. And last but not least, developing simple, effective, and context-specific educational materials, in particular visual aids for CVD and other non-communicable diseases. So our issue brief we have prepared for Ethiopian Ministry of Health NCD division has this implication. We can say that a better awareness of CVD and associated risk factors will be associated with healthy behavior and lifestyle. And in turn, this can contribute to improved disease prevalence and a reduction in morbidity and mortality. Hence, NCD division at Ministry of Health in Ethiopia should strengthen and support a community-based educational intervention undergoing to prevent CVD and other NCDs. So simple, effective. Hello, Natri. So simple, effective, and context-specific health promotion messages by trained health extension workers or healthcare providers will enhance the acceptability of the message and the subsequent adoption of preventive actions and health-seeking behavior in urban and rural settings. The proposed actions are feasible within the available healthcare structure and human resources. So the health extension workers and health providers are primary healthcare unit can lead implementation of community-led collaborative learning. So the brief story looks like it.
Yes, that's perfect. And it's interesting that you're also sharing with us the recommendations that you have for the NCD director. And It's really interesting to hear that the research has evolved into multiple products. You said you had meetings with the communities, which was really important. There were mass media campaigns. I think it'll be nice to hear a little bit about that a little bit later. You also utilize religious places to influence the community and to share the results and the importance about cardiovascular disease. And I think that's really important to think about the various different platforms and areas and people that communities trust and want to listen to, and how to work and collaborate together with them. So much about this is about partnerships, isn't it? Partnerships with the ministry, partnerships with religious leaders, with the communities, and the fact that you also wrote an issue brief. And thank you so much for sharing the recommendations that you had in that issue brief. Have you noticed that there's been any change in terms of raising awareness, a change in perceptions and behaviors from the communities, given all the engagement that you've had with them over the last few months and years?
Yeah, I can say that there is a change in a society because our project originally has a three-phase project. So in the beginning, we have conducted a qualitative research, then followed by a citizen scientist implementation project. Then finally we screened for CVD risk prevalence. So during all the three phases of this project implementation, in the first, even we have made peoples who even can't tell the position of or the position of the heart or the location of the heart, but we have changed the way to teach them. So basically, in rural setting, we have used a visual document which will help to educate them, and we have seen a significant change in CVD risk perception, especially in rural setting.
That's phenomenal, Farrell. Thank you for sharing that with us, and congratulations on being able to actually see the outcomes of those kind of efforts on knowledge translation and stakeholder engagement. We'll come back if we have time to more questions. Even I'd like to encourage our audience, if you have questions for the stories and the experiences of our colleagues, to please paste them in the Q&A, and we'll try and get to them after. So I'm going to move on now to introducing one of our other colleagues from Malawi this time. I'm not sure she's able to put her video on. She's had to escape into her car to be able to be on this panel. So Talitha Mpando is a public health professional currently working as an integrated knowledge translation focal point at the Kamuzu University of Health Sciences in Malawi, within the SEBA Research Consortium. She has interests in evidence-informed decision-making, in knowledge engagement, and also the upstream determinants of health. Talitha works with a very talented team in Malawi and is here to share with us her experiences on their partnership with the Ministry of Health, how they engage with them to participate in evidence synthesis capacity building, particularly for COVID-19, using all the tools that they've been using in the SEBA project, and particularly to see what that research is. She will also be touching upon advocacy as well, and how that's worked in the role of an academic institution like the Kamuzu University Health the department. So welcome, Talitha. And thank you for adjusting yourself to be able to join us today on the weekend, as well as all those of you that are listening to us. So Talitha, if you could unmute your mic and share with us a little bit of your experiences with the Ministry of Health and the work you've been doing through SEBA, but also on the COVID-19 work that was also supported by SEBA over the last year. Over to you.
Good afternoon, Nasreen, and good afternoon, everyone. Apologies for joining in late. I had a few technical issues. With our SEBA team, we have been working consistently with the Ministry of Health. So our Ministry of Health has a research department, and under that research department, there's a knowledge translation platform. So in our IKT work, we always engage them in everything that they do, in everything that we do. They take a lead and we need to have them on board. So with the onset of the COVID-19 pandemic, there was a lot of research coming in, obviously because it was a very new area, and a lot of scientists were interested to find out what kind of research they can do so that it can inform decision making at a national level. But they found that there was a gap in terms of turning that research into making that research accessible to policymakers and other decision makers. So the Ministry of Health and Knowledge Translation platform specifically decided to have capacity building for researchers after noticing that gap. And we were invited to take part, since we had some trainings beforehand and some sort of events that had to do with evidence-informed decision making. So we were asked to come on board to help to build the capacity of researchers, not only in the area of non-communicable diseases, especially because COVID-19 was cutting across so many sectors. So it was quite interesting to see that there was actually a huge need for AIDM capacity building. And it was also interesting to note that we were isolated as one of the partners who could help to make this possible for other researchers in not just NCDs, but other fields as well.
Thanks so much, Talitha. What in your mind is like the biggest lesson or learning that you'd like to share with all of us with respect to engaging in this way? And if you can say a little bit more about what is a knowledge translation platform for folks and colleagues that are joining us that may not be familiar with that term.
Okay, so a knowledge translation platform, in our scenario, it's part of the Ministry of Health. So they kind of act like a middleman between researchers and policymakers. So they provide platforms for engagement between the two, since they might not necessarily interact. So they just make it easier for researchers to be able to push their findings so that they're used in decision making, and also for policymakers to make sure that whatever priorities have been found, for example, in the health sector, so that research is done in those particular areas. So with the SEBA class of project, we really work hand in hand with KTP in Malawi. And in terms of lessons learned, I think one of the greatest lessons is that we cannot, researchers cannot operate separately from policymakers, so they need to be able to find a platform, a way of engaging. The two need to be able to have some sort of interface where both parties are able to hear from each other, and they need to be able to do so in language that is understandable to both the researchers and the policymakers.
Such important lessons in terms of the, not working in silos and multi-sectoral collaboration, but also engaging with stakeholders throughout the process of a research study is so important. And I think we're seeing from the stories we've heard from Ethiopia, Malawi, and Uganda so far, what difference it really makes in terms of the use of the research for decision making. So that's very helpful, Talitha, and it's really interesting to hear that you have an embedded knowledge translation platform in your ministry in Malawi that really facilitates the utilization of research and evidence for use in policymaking. That's a really interesting model. Thank you so much for sharing that.
Thank you.
So
Nadia.
now I will come back to all of you at some point, but I'd like to move over to our colleagues and brothers and sisters in Rwanda. We are joined by Salaman Shirintege, and he's currently working at the University of Rwanda as an assistant lecturer and SEBA project coordinator. And he's also currently doing his PhD in Basel. He is interested in health systems financing and economics, obviously non-communicable diseases, since that's what the SEBA project is all about, but also nutrition and reproductive health. He's going to be speaking particularly again about how some of the lessons and strategies used in the SEBA project were used for COVID-19 mitigation measures in Rwanda, which included social distancing and lockdowns, and how the imposed restrictions affected negatively on the level of physical activity. Physical activities and the lifestyle of Rwandan residents has been something very important in the SEBA project, and how COVID-19 in some ways was, and the restrictions in physical activities was compounded by low community knowledge of NCDs. So he's going to be speaking to us about how research results were communicated with the Ministry of Health, given that they have been very involved and supportive of interventions in Rwanda, such as Car-Free Day, to address the NCDs. So Salaman, welcome to the panel. Thank you for being with us. It would be great to hear a little bit about what these interventions are for physical activities in Rwanda, and that how that all changed during COVID-19, and what you and your team were involved with to try and mitigate any risks. Thank you, Salaman. Over to you.
Thank you so much. I'm happy to join the panel, and I'm looking forward to share more experience. Actually, our story is about the Car-Free Day, and as you mentioned, the issue was mainly with the COVID. But to start with, before the community was too much engaged, and mainly with our stakeholders, to mention but a few: Ministry of Health, Rwanda Biomedical Center, Ministry of Sport and Culture, and those stakeholders was much involved in screening, because for example, if we are meeting for Car-Free Day, we are supposed to organize and meet people, especially on screening of NCDs. And the organization was not only with the University of Rwanda, but also with the Ministry of Sport and Culture, with the Ministry of Health, and the Rwanda Biomedical Center. We very much engaged with the communities, because the main target was to invite them and to see them participating in the Car-Free Day. And the Car-Free Day mainly is twice a month, but also we have another organization on Friday, the Friday Physical Activity. The Friday Physical Activity is mainly for the civil servants, and the policy in Rwanda, the policy is very clear that every Friday in the afternoon, starting from 3 p.m., the civil servants are invited to go and do physical activities. They have the transcription, they have the registration to the gyms, they have also the local organization where they can meet for the football pitch, they can meet for volleyball or basketball, but mainly they are supposed to report and monitor the implementation of that policy. As you mentioned, during COVID, it was stuck, because we had lockdowns around. We have our people and the civil servants working from home. It was not possible for them just to go and join the physical activities in the groups. But we opted to recommend and insist on how we can continue this physical activity during the pandemic. It is one of our issue belief. The pandemic, the the main idea was to share that even if we are facing the pandemic, the COVID and others, but we have to keep the pace of physical activities just to mitigate the risk factors and other issues. Now, we opted to recommend and engage the stakeholders, mainly Ministry of Health and the Rwanda Biomedical Center, through our issue briefs, and they acknowledged the reception of that issue brief. They tried just to discuss with us, and we shared the feedback. And the idea is to look at how we can continue the physical activities during the pandemic. Now, we are going to the second phase of engaging the community people. You remember the idea before with the SEBA Plus, we engaged and we worked with the citizen scientists. The citizen scientists were working with us on the research of screening of NECDs. Now we are engaging them in the rural and urban to see how we can take that physical activities in the communities even during the pandemic, because we are supposed to have them like in the local communities, not going far from their homes, but also how to engage and how to monitor them during the implementation. For example, we are trying to see how we can use the mobile phones, and through mobile phones we can share the physical activities, the animation, the coaches that are participating online, and they can join. And we also engaged with the government of Rwanda, Ministry of Health and the Ministry of Sports to work on TVs, like the TV shows. People are meeting there, they are at home, they are in their communities, but also they can do the physical activities. That is mainly what we are trying to do. We shared the issue briefs. Now we've shared 4 of them, and we are looking forward to continue the engagement and collaboration. The motto on our side, the engagement is there to stay, not with SEBA, but after SEBA, we are looking forward to continue with them. Thank you so much.
Fascinating, Salaman. Thank you. And you almost answered the question I was going to ask all of you, is about sustainability of this approach after the SEBA project, because as we all know, when it comes to research grants, they're often marked by a period of time, and once they're finished, we all move on to different projects and different grants. But it sounds like all of you have really invested a lot of time in relationship building with your stakeholders. And you've also all really explored different forms of engagement. I mean, Salaman, you mentioned TV shows, issue briefs. You talked about supportive organizations. It's easy to say everybody must do Friday, but if you don't give, you must do exercise on a Friday, but if you don't give people the time off and insist that they leave their offices at 3 o'clock to go and do the exercise, it's not helpful. So we need, our public health interventions to be supported by institutional policies, by regulations, and I think that's a really nice example, excuse me, that you give from Rwanda. Our other colleagues like Firal and Bonnie and Talitha all talked about different forms of engagement, the utilization of media, journalists, mass media, but also community meetings. And it sounds like all these relationships have been built over time and will be continued to be supported. But as I wait for our colleagues, our participants that are listening to us, please, if you have any questions for our panelists, please put it in the Q&A. We don't have any questions there at the moment. So I will start with this question to all of you is, in line with Salaman's vow and motto, to continue this beyond the SEBA project on non-communicable diseases, how do you all plan to sustain the integrated knowledge translation approach and to continue to work with these stakeholders that you've built relationships with? So I'll start with Bonnie and then to Firal and Talitha.
Yes, thank you very much, Nazreen. So how do we plan to sustain these relationships and interventions that we've been able to build with SEBA? So before SEBA, we had been working with some of these stakeholders. And so what SEBA introduced is sort of engaging the stakeholders in a more formalized way and documenting this and having to refer to having like setting out a stakeholder map, who you engage at what point, and then sort of updating this. But now for sustainability, we of course will continue to work with them. We have other projects within the unit that are focusing on the same domains. But we've also, I think, given the relationship that we've been able to build with IKT, we've actually had some of them come to us with problems that they feel we need to help them point out who we should contact for funding and things like that. Recently, there was an advert call for, I think, cities to apply for safer infrastructure grant from the World Bank. And because we had actually had this dissemination and talked about the state of infrastructure for vulnerable pedestrians, we were able to share this with the colleagues from Kampala Capital City Authority, those that attended our meeting, and those that came from Jinja. Jinja is one of the secondary cities. And so we are still actively engaging them. And given the relationship we've been able to build, they actually also come to us with requests, but also guiding us on what we need to focus on. So I see this moving forward beyond SEBA funding.
That's great. So you're still continuing to use the same approach on some more strategic stakeholder engagement, but also opportunities for ad hoc engagement whenever it makes sense to be able to proceed with this kind of work and action. Thank you, Bonnie. Phil.
Thank you, Nasreen. So from our side, we have engaged our stakeholders from the conception of the proposal to date. Besides, we were engaging with other stakeholders like in ad hoc base, and we have also introduced our project for some of NGOs. We have created multiple collaboration because there are still interests in CVD across Ministry of Health, and we can say even NGOs. There are NGOs who are currently working in CVD, including other NCDs. So we have already created a collaboration. So this collaboration built across the country will help us to maintain this IKT approach. And finally, I can say that in Armor Hansen Research Institute, we do have a knowledge management directorate. It is a newly established directorate with 3 years back, but it works the initiative we are talking about integrated knowledge translation in SEBA. So even though our SEBA project is going to fade out, the integrated knowledge management or the integrated knowledge translation will continue in our institution via that directorate. So a knowledge management directorate is one of our internal stakeholder, and we were working together for the past 4 years. Thank you, Nasreen.
Great, thank you so much for sharing that, Phil. Talitha, your plans for sustainability on the approach.
Thank you, Nasreen. So I think one of the things that SEBA has done very well is capacity building, not just for its staff, but also for other people who might be interested in things like knowledge translation and EIDM. So with the number of capacity building events that we've had, I think that we have actually created a demand for skills in knowledge translation, and people just have started to appreciate the need to have such an approach. So, and also being involved with the KTP, building that relationship. So they don't necessarily view us as a project, but they see individuals when they look at us, and when they have some sort of event that has to do with building capacity for other researchers, they might invite us on board to take part. So I think the approach will definitely be sustained, because it's moved beyond the project, and it's gone to the level of the institutions and just other individuals beyond the project.
Fascinating, Talitha. Thank you so much for sharing that. And last but not least, Salman for the last minute, and then if there's no questions, we will wrap up today's session. So over to you, Salman.
Thank you so much. Just to continue on what my colleagues mentioned, we are planning to continue the engagement with the stakeholders, and as I said, the engagement is there to stay, mainly with the capacity building, as Tarita mentioned, and the colleagues, but also we in Rwanda, we've specifically organized the local communities with the lead of the citizen scientists. They formed clubs, and the club is mainly looking forward to continue with the community members in their catchment areas. And we are looking forward to continue supporting them, especially on coaching them. We've got a number of contacts on physical activities coaches, but also the NECDs. We have our professors, we have our co-leaders of the research, and they are looking forward to continue working with them. The third one is the intervention to do with the issue briefs. The issue briefs we've organized, we've submitted 4 of the issue briefs, but we are looking forward to continue with them. And we have also 2 issue briefs in the pipeline that we are looking forward to share with you in the network, and also to be shared with our stakeholders. And they are very much engaged. They are very much willing to continue with us and continue with the engagement. Thank you so much.
Thank you so much, Salman. And thank you to all of you first to the panelists for joining us, from Firal from Ethiopia, Bonnie from Uganda, Talitha from Malawi, and Salman from Rwanda, and myself, Nasreen Jassani from South Africa. I realized I did not introduce myself earlier. But thank you to our panelists for joining and sharing their really inspiring stories with us on the importance of integrated knowledge translation and stakeholder engagement. If you want to hear more about the SEBA project and its outputs, I've placed a link in the chat, so please check the chat. A lot of our colleagues online spoke about the production of issue briefs and training on evidence-informed decision-making. If you want to learn more about those, there are courses offered in different parts of the world. We also offer 3 workshops on evidence-informed decision-making and knowledge translation, including how to engage with decision makers and write issue briefs, but also how to engage with the media. And we've also put that link in the chat here. So you are welcome, anyone that's interested in those, to reach out and hear about them. I'm sure many of you listening to us also have very interesting and engaging stories about getting your research into policy and practice. So I want to wish everybody a lovely remainder of your weekend, and enjoy the rest of the conference. Thank you for joining us today. Bye, everyone.
Thank you so
Bye.
much.
Thank you.
Thank you very much.